how to hold it. You have to hold it like this. Okay. Hi. This is the mons pubis. Okay. And these are the internal genital organs. This is uterus. These are the ligaments of uterus. This is urinary bladder. This is rectum and anal canal. Okay. So you have to hold it like this, and you have to start like it. This is the female genital organ with rectum and anal canal. The mons pubis directed forward, the vulva directed downwards, and rectum and anal canal directed downwards. Okay, lies posteriorly directed downwards. Okay, this is the rectum and anal canal here. Achha. Now, what are the parts of external female genitalia? This is the mons pubis. Okay, this one is the mons pubis. This is the labia majora. This one labia majora. Okay, this one is labia minora. This fold. Okay, this fold is labia majora. This fold is labia minora. Okay, this fold. And inside that, it is called vestibule. Vestibule has two openings. Above there is urethral opening. This one is urethral opening, and this one is vaginal opening. Okay, this one is vaginal opening, and this one is urethral opening. Urethral opening is slit-like. Okay, and vaginal opening is irregular. And this part is called clitoris. And you can see here the labia majora. This one is anus. Okay, anal canal. This one is anal canal. So here labia minora meets, and here also labia majora and minora meets. This 2 point is called fourchette. Okay, fourchette, or anterior commissure or posterior commissure. Okay. So these are the part of external female genital organ. What I have said: mons pubis, labia majora, mons pubis. The whole part. This whole part is called vulva. Okay. I have said in the anatomical position, the vulva directed downwards. Okay. So this whole part, along with every structure, is collectively known as vulva.
Including muscles.
Yes. All of these. Okay, including muscles. So what are the parts of vulva? Majora, labia majora, labia minora. Okay. This is vestibule. Vestibule has two openings, urethral opening and vaginal opening, and also there is another minute opening you cannot see here. In the two sides of the vaginal opening, there is opening of greater vestibular gland. Okay, one pair of greater vestibular gland you cannot see here. So if you are asked what are the openings present in the vestibule, you should say three openings. Okay, one is urethral opening, that is lies above this one. This one is urethral opening. Then below there is vaginal opening, and on the two sides of the vaginal opening there will be opening of greater vestibular gland or Bartholin gland. Okay, these are the three openings present in the vestibule. This one is the clitoris. This one is mons pubis, and meeting point of this labia minora. Here it is called anterior fourchette. There is it is called posterior fourchette, or anterior commissure and posterior commissure. Okay, commissure. Okay, so these are the external genital organ, and what are the internal genital organ? You can see this one is the uterus, and they are the ligaments of uterus. Okay, uterus we will learn separately. Okay, this is the urinary bladder. This is the symphysis pubis. So in between urinary bladder and symphysis pubis, this one is the rectopubic space. In between the bladder and uterus, this one is uterovesical space or vesicouterine pouch. Then in between rectum and uterus, recto-uterine pouch or space. Okay. This is the uterus, you can see. Okay. The anterior surface is flat and posterior surface is convex. Okay. This is the fallopian tube. This is the fallopian tube, and this one is the ovary. Okay. This one is ovary. Ovary is strong here. Okay. This portion is called ovary. This is uterus. How to hold uterus? You have to hold it like this. It bends forwards and downwards. Okay. The surface should bend forward and downward, not like this. It is not. It is okay. Forward and downward. This portion is uterus. It is the isthmus or the meeting point of the uterus and cervix. Cervix is this little cervix. This is uterus. This is cervix, and this part is vagina. Okay. Uterus is 7.5 centimeter long. Vagina also 7.5 centimeter long. In between them there is cervix. Okay. Uterus has three parts: fundus, body, and cervix. Okay. It has three parts. This one is the fundus. How to identify the fundus? There is meeting point of the two fallopian tube. Okay. Line joining the meeting point, the above part is fundus. Okay. This portion is fundus. Below that, this is the constricted part. This is called isthmus. From outside it is called isthmus, and inside it is called internal os. Okay. So isthmus, this constricted part, up to this constricted part, this is the body of the uterus. Below this constricted part, this is the cervix. Okay. Then here is also a constricted part. Here is a constricted part. Here is a constricted part. This part is called external os. Okay. Above constricted part is called internal os. Inside and outside isthmus. Below constricted part is called external os. Okay. From external os to outside it is vagina. And from external os to internal os, this portion is cervix. And from the internal os above, this portion is uterus. Okay, clear? What is the length of the uterus? Uterus length is 7.5 centimeter. Vagina also 7.5 centimeter. This is the vaginal opening. It is the internal os, you can see. Okay, this one, this constricted part is internal os. There is also a part of vagina. You can see there are some ligaments here. Okay, these are transverse cervical ligament. Okay, these are broad ligament. Okay, this part is broad ligament. Fallopian tube. It is the fallopian tube. What is the length of the fallopian tube? Is very long. Okay. Here it is very short. It is 10 centimeter in length. Okay. So this is the uterus. How to hold it? The anterior curvature is downwards and forwards. Okay. And fundus lies above. Vagina directed downwards. Okay. It is the anatomical position. Now, what is the peritoneal relation of the uterus? Very important. Up to this internal os. Okay. Whole anterior surface is covered with peritoneum, and up to posteriorly there will be folding in between uterus and vagina, that is called posterior fornix. Whole part of this part, posterior part, is peritoneal part. Okay, so uterus kind of intraperitoneal organ. Okay, so up to anterior surface, up to the internal os or isthmus, it is peritoneal. But whole posterior part up to the posterior fornix is peritoneal related. Okay, so these are the peritoneal relation of, and two lateral border. These are two lateral border. It is not peritoneal, it is non-peritoneal. Why? Because of attachment of this ligament. Okay, ligament get attached here, so there is no peritoneal covering laterally. Broad ligament. This one is broad ligament. I will teach you name of the ligament. Broad ligament. This one is transverse cervical ligament. Okay, it inserted like this, and broad ligament inserted laterally. Now here, what will be the peritoneal deflection? Very important. Okay, we know in the rectum there is upper one third is peritoneal and lower 2/3 is non-peritoneal, right? So rectum is a retroperitoneal organ. So peritoneal comes like this, then it reflects forward up to this one is the posterior fornix of the uterus, up to this part, then it goes then upward, then it bends again forward. Okay, anterior, covering the anterior surface of the uterus up to the isthmus, then it goes forward to the base of the urinary bladder, then it goes the superior surface of the urinary bladder, then it goes with the anterior abdominal wall. So what are the reflection here? I am saying again, up to upper 1/3 of the rectum there is peritoneal relation. Then there is formation of a pouch or reflected part of the peritoneum like this, up to posterior surface of the uterus, up to posterior fornix, then it goes above covering the fundus of the uterus, then it goes again anteriorly of the uterus up to the isthmus, then it goes forwards and upwards, upper part of the base of the urinary bladder, superior surface of the urinary bladder, then it merges with the anterior abdominal wall. Okay, so what are the pouches formed here? We can see two pouches are formed here and here. Which pouch is this? It is uterovesical pouch or vesico-uterine pouch. What you can say? Okay, there is a pouch, and there is also a pouch that is recto-uterine pouch or pouch of Douglas. Very important. This pouch is important because of they are the most dependent part of the peritoneal covering. Okay, most dependent part. So any collection that is fluid, blood, pus may accumulate here. Okay? And when we go through the vaginal orifice up to posterior fornix, we can easily collect the collection from here. Okay, with the syringe. It is a clinical importance. Okay. By inserting a syringe through the vaginal orifice, through the posterior fornix, we can directly go to the pouch of Douglas. Okay? Because it is related to the posterior fornix, right? After posterior fornix, the peritoneum comes and it reflected. So pouch formation occurs in the posterior fornix. It is also a site of ectopic pregnancy. Okay, abnormal implantation. These ligaments are uterine ligaments. This ligament is broad ligament, and this ligament is transverse cervical ligament. Okay, this one is, you can see they are clearly dividing. This is one ligament and this one is another ligament. This is broad ligament and this one is transverse cervical ligament. We have to know the contents of broad ligament. That's all.